Welcome back to the TV24 News. We are pleased to welcome Dr. Michael Jennings to the studio. Dr. Jennings is with Clinical Urology Associates and was recently recognized as a Center of Excellence for Axonics Therapy, a treatment for overactive bladder. Dr. Jennings is an expert in robotic surgery, including surgical implantation of the up-and-coming bladder pacemaker device. Dr. Jennings, welcome.
Thanks for having me, Courtney.
Thank you for being here. So I've been very much looking forward to learning more about this because, a bladder, it's very important.
You know, as urologists, we have the ability to treat a lot of ailments and see patients for a variety of things. This is actually probably one of my favorite surgeries to perform because it takes a problem that it can really be, interrupting to one's life. It takes somebody who's scared to go outside the house, scared to, always having to know how close the bathroom is, and it can really kind of give them their time back, give them their life back. So it's a good procedure.
Absolutely. So who could benefit from this procedure?
So there's different types of incontinence or leaking urine. This tends to be one of the most common, which is overactive bladder. You've probably seen many commercials on TV for different types of medication. What I like about the procedure is it's minimally invasive. You get to try the procedure before you have the full implant, and that trial can be done in the office. The patient wears the device on the outside for about 5 to 7 days, and if it helps them, then we're able to do the full implantation, which is still only about a 20 or 30-minute procedure in the hospital for outpatient surgery. It is about 85 to 90% effective for urinary incontinence. It's probably even more effective for fecal incontinence or bowel accidents. It can also be used for people that have trouble urinating. So what it does is it really just regulates the nerve that controls the bladder. The good thing about it is that it's performed in the low back, so in no way is it around the genital areas or anything like that. It's very comfortable and easy for the patient.
Okay. Yeah, it would be great to not have to rely on medications because there are so many things that can... Absolutely.
That is one thing we're seeing coming out of COVID is that people are turning their attention back towards traditional medical problems. And a lot of overactive bladder is treated with medications traditionally. Recently, we found that a lot of these medications, especially the older ones, can cause dementia-like symptoms in people, approaching their 60s. And so this is a nice way to get people off these medications. It's is a way, honestly, in the long run, it's cheaper for the patient because a lot of these medications you're on for the rest of your life, and this is an ability to have a quick procedure to correct the ailment.
Yeah, so it's an outpatient procedure. How often does it last? How long does it last, or how often do you have to? Yeah,
typically the battery lasts anywhere from about 12 to 17 years. If for some reason you had to have a replacement or a new battery, it's an even simpler procedure that can be done, under just minimal sedation. It takes about 5 minutes. So.
Wonderful. How do you charge it? So it's a battery?
Yeah, so there's one you can recharge that you charge once a month, or now actually they're every 6 months. That lasts typically towards the longer end of the range, closer to 17, 18 years. The one you don't have to charge, actually you don't have to do anything, lasts about 10 to 12 years. So to charge it's just a little Bluetooth device, just like headphones or anything like that. You just connect to wear a little belt on your low back.
Wow. So are there any age ranges or qualifications or?
Typically, there's no age ranges. We've done patients that as young as in their 20s. Typically, you do have to at least try and fail a medication or have side effects from a medication, but it's almost always covered by insurance once you meet that criteria.
That's great. So how would somebody get in touch with you if they are interested in learning more or possibly even doing the
we actually have, there's online surveys you can take. There's our office number for Clinical Urology Associates. We have offices throughout North Alabama, Pell City. We have a new office opening later in the year in Jacksonville. We have a main office in Gadsden and then also in Guntersville.
Okay, so here's the information. So if you're interested to schedule a consultation, call 256-492-4040. They would be glad to schedule a consultation and see if this new device is beneficial to you, which it sounds like it could be to a lot of people.
It's a great surgery.
Yeah, awesome. Well, thank you so much for being here with us today, and we look forward to a follow-up interview and keeping posted on all the things that you guys are doing there at Clinical Urology.
Well, thank you. I appreciate you having me.
Yes, thank you so much. So So stay tuned. Weather with Lacey Clance is coming up, and you're watching the TV24 News presented by Team 1 Chevrolet of Gadsden.